Children abused by a paedophile ring in a drug den dubbed the Beastie House were also at the mercy of catastrophic care service failings, a new damning report has revealed. Red flags were first raised to authorities in 2007, 16 years before the heroin-addicted sickos who raped them were finally jailed. A long-awaited learning review tells us how the welfare of heroin-hooked predators came first, with care workers branding one child victim nasty. The paper states, in meetings, professionals on occasions described her behaviour as nasty and that she interferes in matters that don't concern her. The report adds, in this case 25 risk factors were identified in total, but not prioritised or evaluated. Scotland's child protection system could not guarantee such cases would never happen again.
I think you have to look at the beginning of the report, where it's quite clear that the adults involved in this case were what I would say devious and deviant, where they went to great lengths to mask what was actually happening to the children. The children didn't feel confident enough to disclose the abuse against them until they had been safely removed from the care of these adults. I've been around in social work for over 50 years. I've been involved in lots of high-profile cases. I've been involved in the Lockerbie disaster, and this is one of the most shocking cases I've encountered. And I couldn't say, hand on heart, that a case like this would never happen again because of the devious and deviant way that adults can exploit children.
The dossier of disaster was today made public, 16 months after 7 pedos were caged for a total of 93 years for subjecting the children to depraved sex attacks. We told in January last year how 47-year-old Ian Owens, Elaine Lannery who's 42, Scott Forbes who's 53, 49-year-old Barry Watson, Leslie Ann Williams who's 45, Paul Brannan who's 44 and 50-year-old John Clark were all locked up and hit with lifelong restriction orders at the High Court in Glasgow. The document sheds new light on heartbreaking moments the vulnerable kids made eye contact and sought physical comfort from visiting professionals, innocent pleas for help which were ultimately ignored. And one incident described a girl known as Child A begging a school nurse to be rescued from the insect-infested home where a stream of depraved junkies came and went. The report published today by the Glasgow City Council's Child Protection Committee reads, Child A tried to prevent the school nurse from driving away after she had visited the house and didn't want to be left at home. On another occasion, Child A banged on the windows, shouting at the health visitor not to leave. This was rationalised as characteristic of Child A's challenging and streetwise behaviour, rather than a serious indicator of distress. Another victim, named Child B, was just a year old when it was noted he presented as distressed on occasions with episodes of headbanging. But the alarming acts of self-harm once again failed to trigger appropriate steps that could have prevented the escalating horror. The timeline to the tragedy began in 2007 when the eldest of the 4 children was still in the womb, a time when there was multiple agency involvement. When the girl was born in April that year, she was placed on the Child Protection Register as a child at risk before the decision was made to remove her from the register 4 months later. Concerns were raised again in December, but a majority decision not to register the child was made, flying in the face of a health visitor who disagreed, believing the ongoing risks were significant. As their plight worsened, the children were described as being grubby with dirty feet and wearing unwashed clothes. They had black decaying teeth and were seen by neighbours begging in the street and complaining about feeling hungry. Ominous signs were also noted in the classroom, where Child A wrote a note saying, I hate myself, and had previously said she wanted to kill herself. It goes on, Child B asked staff to smell his trousers because other children said he was smelling of poo. His presentation became more withdrawn, and over time he displayed increasing distress and unhappiness. The paper adds, in 2018, the Out of School Care Project observed Child A was reserved with other children, clearly embarrassed by the head lice issue and upset that other children said she smelled bad. Staff working at the drama club observed Child A and B being bullied by other children eating food in front of them as they were always hungry. The document goes on to reveal a Good Samaritan stepped in to take the children out of their dreadful predicament in 2019. It reads, Child A described the importance of the time she spent at the local church. One child said of the church gatherings, it was safe and fun, we could forget about things. The children also valued the relationship with church worker Mr G, who later became their carer. Child B said of the kind-hearted man, he was there for me. Astonishingly, some of the care professionals who failed to act on the red flags also refused to engage with the investigation into what went wrong. It reveals not all relevant staff took part in the engagement phase of the review at how the children's plight continued year after year. It adds the circumstances of the case and the abuse disclosed by the children has been distressing for staff and managers involved. As a result, some frontline social work practitioners declined to be involved in the review. Report author Judith Tate, supported by Professor Alexis Jay, said the decision not to take part impacted the process and necessitated a departure from guidance and the principles of the learning review model. She goes on to call on the Scottish Government to address the fact current national guidance for undertaking child protection learning reviews makes no reference to the expectations of staff to engage. If learning reviews are to succeed in identifying the full range of learning to protect future children, the right staff need to be involved. The Scottish Government should consider including participation within the guidance. The lengthy document goes on to identify a period of homelessness suffered by the victims, adding the impact of this on the children's well-being was not recognised within decision-making meetings. The focus was on current risks and concentrated on the adults, not the children. Another barrier identified was the context of working within Glasgow and the levels of deprivation and need experienced by families in Scotland's largest city. Professionals spoke about the inevitability of neglect within the profile of the communities and services they worked in. The report concluded there had been poor recognition, assessment and response by professionals to signals of distress shown by children, adding it was difficult to comprehend that abuse was not identified despite regular contact with the agencies. The review identified broader systemic issues including the communication between agencies, higher staff turnover, lack of management oversight and insufficient confidence among staff in identifying neglect as a form of harm. In conclusion, the paper states the review has explored professional practice and the factors that influence the practice as both enablers and barriers. It has shone a light on the areas for organisational improvement that, if implemented, will strengthen practice and help to protect children now and in the future and better support and look after those working within child protection systems. It has revealed systematic barriers for national agencies to consider that addressed will impact positively on child protection systems and well-being and learning improvement. Colin Anderson, independent chair of the Glasgow City Child Protection Committee, today welcomed the publication of this learning review report and he accepted its findings.
And the report is quite clear that it says that the systems which, in terms of getting it right for every child, that are designed to protect children, did not protect these children. And we could have and should have done better, and we will do better in the future. Children should be front and centre of every case, that we should listen to the children and not to the adults in terms of collecting and collating evidence and using that evidence to support professional assessments and judgments.
We told how the children helped snare their tormentors by giving evidence at trial. Judge Lord Beckett told them they may never be freed from jail as he hailed the extraordinary fortitude of the gang's 3 victims who endured grotesque attacks, violence and exposure to heroin.